Some disturbing news coming in from West Bengal. Infant deaths are haunting Mamata Banerjee again. 19 babies have died at the Malda Medical College Hospital since Saturday. Well, 6 of the babies died yesterday. Hospital authorities are giving the now familiar line of reaction, saying these babies were brought to the hospital in a critical condition from North and South Dinajpur districts, and that they were suffering from malnutrition. The doctors also say that the babies were underweight and born prematurely. Also, what's not working in favor of the hospital is an overcrowded pediatric ward. The hospital says the Union Health Minister is currently monitoring the situation. This, remember, is the second instance of crib deaths at the hospital this year alone. 27 babies died at the beginning of this year under similar circumstances. Manogya Loiwal now joins us on the phone line from Kolkata with the latest. Manogya, 12 infants dying in Malda in less than a week. Government explaining this on the basis of malnutrition cases that have been reported from adjoining districts. But so many deaths in 1 week in one hospital, something doesn't add up.
Well, absolutely, and you could expect the death toll rising also of the infants. The basic reason being that despite all the poor infrastructure that the government has in the nearby districts or its own district where the hospital is located in Malda, the government has only excuses ready to explain on how the problem is of malnutrition. And even if that is the case, it is of course a fault on the part of the government in being unable to provide the basic amenities and basic provisions of humanity and for survival of livelihood for these people in these districts. Despite the West Bengal government saying that these people had arrived from nearby districts, they cannot deny that these districts too are a part of West Bengal. And given all the facts, we cannot deny that this is the same hospital which saw around 27 deaths early this year, and every time the winter season sets in, the government and the officials of the hospital come up with new excuses, and this time they say that the number of children that had arrived, the number of infants were around 156, despite a basic capacity of around 50 beds in the hospital. The hospital has been blaming and claiming that the number of people who are there in the pediatric ward every minute is more than 100, which is of course double the number of people that can be accommodated in that area. But this of course is an excuse by the government and the officials of the hospital who could manage, or who could just, the way they have always asked media to stay away, they could ask these families also to stay away from the kids who are admitted in the hospital.
Right. Manogya, while the government and the health ministry there might have some explaining to do, but what about the claims that are being made by the hospital? This isn't the first time, as you mentioned yourself, that these crib deaths have been reported from the very same hospital. Are the services, is the hospital really hard pressed, considering there aren't many good hospitals in the vicinity?
Well, absolutely. That is the basic reason Malda Medical College and Hospital has been upgraded to a college and hospital last year. Since then, the number of people who have been arriving with patients in the district has almost tripled. That is the basic that we expect. But the reason is that Malda Medical College and Hospital is perhaps the only hospital that has the basic amenities or is comparatively better.
I'd request you to hold your thoughts. Let me also get reactions in now. We have CPM leader Mohammed Salim now joining us on the phone line. Mohammed Salim, my first question, sir, we have seen instances like these earlier as well, very disturbing cases of crib deaths being reported from state-run hospitals really. Has nothing changed over the past 1 year since these incidents first came to light?
Nothing has happened in between, apart from some sound bites and repeated callousness proven by you and by others, on the part of the government of West Bengal. Now the change is only because Chief Minister Mamda Banerjee herself took over the responsibility of Health Ministry when she formed the government last year. Now she could not do anything. That's why she has now divested that to another junior minister, and she became the cabinet minister. But with the change of faces, nothing is going to happen, because it's the irresponsiveness and irresponsibility of the government of West Bengal. They are so insensitive towards the infant death, and particularly in Malda, because it's either Congress bastion traditionally and Congress is absent, and Mamata Banerjee's every decision is marked by our political motive and political benefits.
But Mr. Salim, the accusation against the left parties in West Bengal is that it's all good to ask Mamata Banerjee to be responsible for this. But what about the left parties which ruled state for many, many years? They're the ones who are responsible for this bad infrastructure in the state.
I expect an anchor or news reader or news editor from the channel like you should be well informed, and it should be studied. You should know that in 34 years, the infant mortality rate from West Bengal was brought down from 73 to 32. And now within 1 year, it has increased another by 1 point. So, another one. So, this is what the callousness and this is what the irresponsibility on the part of the
So, Mr. Salim, you're saying it's a recent phenomena and the mortality rate which is going up is directly because of the misrule of Mamata Banerjee's government?
Irresponsibility on the part of the government is destroying the public health system because they want to bring the private health partners. That's why they are destroying deliberately the public health system, and they are just mismanaging hospital, and it's a lack of management and it's a lack of controlling the human resources and nutrition.
All right, Mr. Salim, thank you for joining us with your views. So, blaming Mamata Banerjee's government, holding it responsible for these deaths, calling them clearly avoidable deaths, saying that the mortality rate has gone up considerably ever since Mamata Banerjee's government came to power in West Bengal. So, clearly politics over crib deaths taking place in West Bengal.